Hello, my name is Rory Ritz, and I'll be sharing our article on symptomatic autonomic dysfunction in patients with IC-BPS. The importance of this study stems from the fact that IC is a highly prevalent condition, yet its pathophysiology remains incompletely understood. In order to further investigate the mechanisms behind IC, we looked into the role of the autonomic nervous system since there has been some evidence of ANS dysfunction in patients with IC and in comorbid conditions. Therefore, our objective was to assess the relationship between autonomic symptom severity and clinical characteristics of patients with IC. We chose to utilize the COMPASS 31 questionnaire to assess autonomic symptom severity, which is a validated 31 question survey scored from 0 to 100 and contains 6 domains as seen here. We used a retrospective cohort study of IC patients undergoing hydrodistension, during which bladder capacity and Hunter lesion status were evaluated. We also administered symptom questionnaires and determined the presence of 12 conditions that often co-occur with IC, as listed here. In assigning study groups, our goal was to compare IC patients with a relatively normal autonomic symptom load to patients with a high symptom load. This led to us breaking our cohort at the first quartile, which was 20.36, leaving us with group 1, our low symptom load group, and group 2, our high symptom load group. Table 1 shows demographic data. Our cohort is majority female and white, and the overall mean COMPASS score was 35.21, which is 3 to 4 times higher than what's reported in healthy patients. Table 2 compares group 1 and group 2. None of the demographic or racial data is significantly different between them, but group 2 has significantly higher bladder capacity, fewer Hunter lesions, and higher scores on the PUF. Comparing comorbid conditions, we see that group 2 has more co-occurring conditions than group 1, and that the prevalence of 9 of these 12 are more prevalent in group 2. In summary, we found that our cohort's mean COMPASS score was 35.21, which again is 3 to 4 times higher than expected in healthy controls, and group 2's results track consistently with a non-bladder-centric phenotype. In conclusion, patients with IC have a high autonomic symptom load, and a significantly higher symptom load strongly correlates with a non-bladder-centric phenotype. Thank you.